Welcome to the recorded version of the Grantmakers in Aging web seminar, Strengthening the Gerontological Workforce, featuring Bronwyn Keefe, Alan Holmland, Kathy Kuhn, Joan Zlotnick, Barbara Silverstone, and John Feather, from October 5th, 2015. This event was made possible by a partnership between Grantmakers in Aging and the John A. Hartford Foundation. Technical and production support is provided by the American Society on Aging.
Thanks so much, Steve, and thanks to all of you who have joined us today. We have a very large number of folks on the call with us today, so great to see the interest in this important topic of strengthening the gerontological workforce. Before I begin, I want to thank the John A. Hartford Foundation for their continuing support of this series, as well as the American Society on Aging for their technical and production support. The unrecognized and untreated mental health issues in older adults is a significant and growing public health issue. One of the greatest barriers to addressing the mental health needs of older adults is the lack of trained professional staff in the gerontological workforce. Our speakers today are going to be sharing information about two innovative programs geared towards training senior center staff and social workers to adequately address the mental health needs of our aging population. With us today are Bronwyn Keefe, the Associate Director of the Center for Aging and Disability Education and Research at Boston University School of Social Work, Alan Holmland, Director of the Suicide Prevention Program at the Massachusetts Department of Public Health, Kathy Kuhn, the Director of Workforce Development at the Center for Aging and Disability Education and Research at Boston University, Joan Levy-Zlotnick, the Principal Investigator of the Hartford NASW Supervisory Leaders in Aging Program, Barbara Silverstone, Director and Co-Investigator of the Supervisory Leaders in Aging Program National Coordinating Center, and Nora O'Brien-Surik, the Senior Program Officer at the John A. Hartford Foundation. Welcome to you all. Bronwyn, let's start with you. Tell us about how the training program that the Center for Aging and Disability Education and Research, or CADER, created to educate senior center staff on mental health issues of older adults.
Wonderful. Thank you so much. Good afternoon. My name is Bronwyn Keefe, and I'm a Research Assistant Professor at Boston University School of Social Work and the Associate Director at CADER. Today we're going to discuss a project on workforce development in behavioral health and aging, enhancing competencies for workers in senior centers. Next slide, please. So this program, actually the next slide after that, please. This program was funded from the Suicide Prevention Program at the Massachusetts Department of Public Health. For this program, CADER at Boston University partnered with the Massachusetts Council on Aging and the Executive Office of Elder Affairs to provide a validated competency-based training program that addresses the core knowledge and skills needed to effectively identify and respond to older adults with mental health and substance use concerns. This program was also meant to increase resiliency and further the prevention of suicide. Senior centers are often the first place older adults turn to for support services, including mental health services, but they often lack the resources and training to effectively respond. For this program, we are providing training to 125 senior center staff across Massachusetts. I'm going to turn the presentation over now to Alan Holmland from the Department of Public Health in Massachusetts, and he will describe some of the important initiatives happening at DPH.
Thank you, Bronwyn. I'd like to give you some background here. Department of Public Health actually has a line item from the legislature that we have been receiving for suicide prevention since 2002. When it began, the funding was rather periodic. We wouldn't know whether we were going to get any money in a given year or not. Around about 2006, we started to get a significant amount of money fairly regularly, and we issued a competitive procurement. And we outlined a number of vulnerable populations that we wanted to purchase suicide prevention services for, and we had workforce development as a priority. So we listed elders as one of our vulnerable populations and workforce development as one of our priority services. We chose elders because the suicide rate then for elders was the highest of any age group. It has since been surpassed by middle-age men in particular, but back then in 2006 it was the highest. We know that the elder population is going to increase markedly because of the baby boomer population. We also know that there is a significant link between depression and suicide, and that elders tend to have a higher than average rate of depression. Our difficulty is that both elder caregivers and to some extent behavioral health professionals are not that skilled working with elders in the area of suicide prevention. So we turned to Boston University to design a program that would reach out to peers in councils on aging and to some extent to behavioral health professionals as well. I forgot to ask to have the next slide, and I'm already almost through. Could I have the next slide, please? Thank you very much. I think I've covered everything on that slide except why others should fund this type of program. And I think by the time our presentation has been finished, that you will see the value of the program that we are offering. Back to Bronwyn.
Wonderful. Thank you, Alan. And I'm now going to pass this next part of the presentation over to Kathy Kuhn, who is the Director of Workforce Development here at CADER, and she's going to go through some of the background on this training program. Next slide, please.
So thank you for having me here today. CADER is part of the Boston University School of Social Work, and we're a national training center for health and social service providers in aging and disabilities, which we've been doing since 2002. One of the great benefits of our center is that we're able to offer online training programs to address the need for workforce training. We have over 35 online courses and 6 certificates in key areas of practice, including certificates in aging foundations, in behavioral health and aging, in care management, and in training of the Aging and Disability Resource Centers. And so each of our certificate programs take about 20 hours. Our courses throughout CADER are skill-based and tied to specific competencies needed for effective practice. One of the benefits of online training is its consistency, that learners can go through similar programs at the same time. Also, its flexibility. We found in this program with the Councils on Aging that people really like the fact that they could take the online courses any place, anytime, at home, in the office. And one of the benefits in the training is that, and Brown will talk a little bit more as we go on, is that we do measure learning outcomes that we have seen to be found to be statistically significant throughout our programs, including this one. Next slide, please. So why did we choose this program? Well, as many of us have said already, that older adults with untreated behavioral health concerns are significantly more likely to have poor health outcomes. Depression is one of the most common mental health issues facing older adults. In the United States, about 20% of older adults report being depressed. And most recently, in a 2014 report in Massachusetts, 29% of older Massachusetts residents had been diagnosed with depression, and in some communities, the rate is closer to 40%. As Alan had mentioned, the suicide rate among older adults is one of the highest of all age groups. And besides the stress on the individuals and communities, hospitalization rates and emergency room usage is as much as 47 to 200% higher in older adults who don't have mental health concerns. Next slide. So the need for workforce training. One of the greatest barriers to the provision of mental health services is the lack of a trained workforce. What often happens is that this leads to unrecognized, undiagnosed, and untreated mental health issues that are costly and even lethal. Many of you may know the study that showed that nearly 70% of older adults who have completed suicide visited their primary care physician within 1 month of their death. That is a very high amount and something that we're greatly concerned about. In 2012, the Institute of Medicine produced a report called The Mental Health and Substance Abuse Workforce for Older Adults, In Whose Hands? And they suggested that the breadth and magnitude of inadequate workforce training and the shortages are in such large proportions that no single approach can adequately address this issue. And they go on to state that these challenges will require focused attention and training. Next slide. So this program focused on councils on aging, also known as senior centers. And as many of you know, councils on aging are commonly the community focal point for social and support services to older adults, their families, and caregivers. In many towns and municipalities, people will go to the senior center to get help and advice. In Massachusetts, we have 349 councils on aging, benefiting 540,000 people annually. And this workforce, along with other health and mental health professionals, though, often fail to receive basic training in aging, particularly training focused on geriatric mental health and substance use. And I would say that this is true not only for councils on aging, but we see this lack of mental health and aging training along the whole geriatric workforce. Next slide. Bronwyn.
Great. Thank you, Kathy. This is Bronwyn again. So I'm going to walk us through the methods and some of the results from this important work. So this training program was a blended training program that consisted of online and in-person trainings. We had 2 hours of in-person training to begin with, then participants went through 4 online courses, and then a final in-person training session. So prior to beginning the program, councils on aging staff were asked to rank their preferences of courses based on relevance to their work and needed training areas. They identified the 4 following online CADER courses for the program: mental health and aging issues, mental wellness and resilience among older immigrants and refugees, suicide prevention among older adults, substance abuse among older adults. So these were the 4 online courses that participants took. Additionally, participants were asked to complete pre-course and post-course competency assessments to examine competency gains. We also asked participants at the end of each course to complete a course evaluation and ask them questions such as, will you use what you've learned in your work, and whether the course met its intended learning objectives, and overall general feedback about the course. Next slide, please. So the results for this program were impressive. Increases in the mean scores from pre to post tests were statistically significant across all competencies for all 4 courses. So some of the results were that 100% of participants completed the first course, online course on mental health and aging issues, and there were increases of 18 to 75% from free to post tests in all 10 competencies. In the second online course, Mental Wellness and Resilience Among Older Immigrants and Refugees, the increases from free to post test ranged from 109% to 363% across all 8 competencies. Those were most impressive increases that we have seen. 91% of participants completed the online course on suicide prevention among older adults. And there were increases from 26 to 98% across the 8 competencies for that course. And in the last course they took, the substance abuse course among older adults, we saw increases from 52% to 129% across all 7 competencies. Again, these were all statistically significant. 99% of participants agreed or strongly agreed the training expanded their knowledge and understanding in the topic area. And 96% of participants agreed or strongly agreed that the training will help them in their work with older adults and will help them to apply practice skills in this topic area. So these results were very impressive for this program with Councils on Aging. Next slide, please. So this chart, which it might be challenging to see, but it really it identifies some of the top competencies for each course where the biggest gains were. So in substance use, the largest gain was 129% in identifying standardized assessments and diagnostic tools that are related to substance abuse. So that competency, they were reporting self-identifying low levels of competencies in that area, and then at the end of the training program, they had substantial increases. For suicide prevention, and I'm just going to name the top ones in the interest of time. So for suicide prevention, the competency that had the greatest increase by 98% was the ability to describe emergency plans that can impact the older adult's safety when they are at risk of suicide. So a very important outcome for suicide prevention work. In terms of mental wellness among immigrant and refugees, again, these increases were quite dramatic. And the one that had a 363% increase from pre to post was the ability to utilize information about depression in your work with older immigrants and refugees. For mental health, we saw the greatest increase by 75% in identifying evidence-based individual and group interventions that are appropriate for older adults presenting with mental health concerns. Next slide, please. So some of the comments here, and these are just a few from participants that took this course. For mental health and aging, folks were saying how useful this was for them in identifying issues, mental health issues for referral, and that they thought they could recognize several conditions before, but realized they didn't have the confidence prior to taking the courses, and now they do. In terms of mental wellness and resilience among immigrants and refugees, folks were stating, this person in particular said, it helped me to understand more fully the process of immigration and the difficulties people face when coming to a new country, and that they would now be more aware of some of these struggles. For suicide prevention, this course, people really responded well to the links and to the many different ways in which they were able to increase their knowledge and competency in the subject of suicide prevention. And for substance use, this person said how struck they were that they were not aware that the stats for elder substance use and risk for suicide were so high, and that since taking this course that they are making an effort to raise awareness about these shocking statistics, and also being more aware of the fact that they can't take for granted that other sort of more assumed sources such as an older adult's doctor or a family might notice these issues and intervene. So these are very important comments from some of our participants. Next slide, please. So for implications and next steps, as previously mentioned, the lack of workforce training for those at the front lines of service can lead to problems in identifying and subsequently intervening with older adults with mental health and substance use concerns. This program saw large increases in knowledge and skills related to the learner's ability to identify and intervene, as well as greater understanding of evidence-based individual and group interventions. Since this program uses an online curriculum that is standardized, this can be provided to any of the 11,000 councils on aging across the country. We believe that this is a cost-effective and efficient way to provide this much-needed training and can be a great step forward in addressing the workforce and population needs. Next slide. So this concludes our portion of the webinar. This is our contact information. We look forward to answering some questions later on in the hour. Should any other comments or questions come up that we are not able to answer during this time, please feel free to reach out to any one of us on this contact information sheet. Thank you very much for your time.
Well, thank you, Bronwyn, Alan, and Kathy. This was very useful information about this important program. I do want to remind you of a couple things. One is that if you open up the chat box, you will see that there is a reference which allows you to go to the slides for today's presentation. So if you want to go ahead and download the slides by themselves, we have that available for you at this point. Also, we have in the question box, if you open up the question section, you can start typing in your questions. We will be having time for us to ask the questions of the individuals on our program today, so go ahead and start doing that if you would. At this point, I want to turn to our next session, and let's hear about another innovative workforce capacity program that's being developed by the National Association of Social Workers and supported by the John A. Hartford Foundation. Joan, tell us about the National Association of Social Workers and the Supervisory Leadership in Aging program.
Great. So if you could go to the next slide. Thank you very much. And thank you to Grantmakers in Aging and to the John A. Hartford Foundation, both for supporting this webinar as well as to supporting the Supervisory Leaders in Aging program that we're going to talk about today. I serve as the principal investigator and project director of the project, but I'll hear from Barbara Silverstone, who is the co-principal investigator and the head of our National Coordinating Center, and you'll hear from Nora O'Brien-Surik, who's the Senior Program Officer at the John A. Hartford Foundation, about why this is a project that Hartford is investing in. Next slide, please. So a little about the National Association of Social Workers to provide some context. We are the largest organization of professional social workers in the United States. We have about 130,000 members. Most of our members are people who have a master's degree in social work, but many of our members are also people who have a bachelor's degree in social work, may have a doctoral degree in social work, and we also have associate members. We have 55 chapters throughout the United States, and also in the Virgin Islands and Guam, and then separate chapters within the Metro Washington area, as well as in New York City. The overall purpose of NASW are to enhance the knowledge and skills of social work practitioners, and that's some of our focus here today, to create and maintain professional standards and the profession's code of ethics, to promote the social work profession, and to advocate for social justice. We provide online and in-person professional development that's led both at the national level as well as our chapter level. In addition to NASW membership, people can get involved with our specialty practice sections, and we do have a section on aging. We're active in terms of our government relations work with both the executive and legislative branch, and we regularly collaborate with other professions and special interest coalitions and working groups, particularly around things like raising workforce issues. The mention was made of the 2012 IOM report on the mental health and substance abuse workforce for older adults, and we were part of sponsoring a Capitol Hill briefing to raise those issues at the national level. We also have capacities in terms of our communication work, technology, fund development, marketing, and social work practice expertise, as well as widespread use of social media, all of which have been important for the implementation of supervisory leaders in aging. Next slide, please. So the particular issues related to the professional development and leadership needs of gerontological social workers, we know that there's a growing demand for highly skilled social workers in the workforce, and one of the critical areas is in the area of services to older people and their families and caregivers. According to the Bureau of Labor Statistics, the social work profession and overall employment is projected to grow 19% between 2012 and 2022. And the demand for social workers is especially high in health and aging service delivery settings. And a lot of this is due to the implementation of the Affordable Care Act and the increased focus on addressing the psychosocial issues like health and mental health and substance abuse issues, financial issues, housing issues, that are transportation issues, that are critical issues in terms of keeping people in better health and out of being rehospitalized due to medical needs. Next slide. We know from our studies around workforce issues that many of the people who are practicing and maybe working in services to older people may not have had specific training in gerontology nor specific training in supervisory skills. We also know that almost 75% of social workers serve older adults in many, many different settings, although they may not be specifically specializing in service delivery that's specific to older adults. And about 12% of social workers work in aging settings. Most supervisors, as I said, have not had specific training in being a supervisor and need skills both to provide clinical support to their staff in terms of the complex needs of older adults, as well as administrative guidance. In addition, research indicates that supervision is one of the key essential components for retaining staff. Thus, investing in supervision is important for improved service delivery outcomes. NASW is implementing this program as part of our regular work with organizations in settings that serve older adults and their families. We are specifically implementing this in 4 NASW chapters: Florida, Illinois, Maryland, and New York City. And those are chapters where we're going to pilot this with the idea that we will learn from how we implement this program there, both to sustain it as well as to be able to replicate it in additional chapters. I now want to turn this over to Barbara Silverstone, who's going to talk more about the specifics of the program, what some of the tenets are of the specific components, and give you some ideas of that as we're just implementing this because it's a new project that was just launched a few months ago. And go to the next slide then.
Oh, thank you, Joan. This is Barbara Silverstone. Good afternoon and good morning to those on the West Coast. Before jumping into a description of the training program, I would like to underscore the fact that the MSW participants in this program supervise social service staff that include both trained social workers and those who are not professionally trained. And as Joan has noted, their work settings are not those exclusively serving older adults, but include hospitals, family service, and home care agencies as well. Now, several educational principles guide the training program and its curriculum. The first relates to the structure and process of the training sessions, including face-to-face small group settings that are essential to ensuring full participation and group bonding. And this was demonstrated successfully in earlier pilot trainings in New York City, where we found that 20 was an ideal number to have in our small group settings. And also, interactive workshops are important with a minimum of didactic teaching. We found the supervisors had much to contribute from their own experiences. A second principle relates to the content of the curriculum. As discussed earlier, enhancing the skills of the supervisor as a teacher and leader and expanding their gerontological knowledge, as well as a focus on cultural competencies, racial equity, and diversity issues. Also guiding the training program is the need for consistency of educational content across the 4 sites in order that the program could be evaluated and replicated in the future. And the last principle, there must be relevance to the learning objectives approved for continuing education credits for licensed social workers in the various states. Next slide, please. The training program that will be implemented shortly in New York reflects these guiding principles, as well as those that will take place in Illinois, Maryland, and Florida in the next 2 years. In these programs, faculty will comprise experts from local schools of social work and other settings. 5 of the workshops listed here address the enhancement of skills in individual and group supervision, skills in leadership and interdisciplinary teams and community outreach and other venues, skills in teaching the gerontological social work assessment, and skills in teaching work with families. 2 workshops are dedicated solely to gerontological content, expanding knowledge of mental health in late life and elder abuse and self-neglect, subjects requested by our trainees in the past and currently as particularly important to them in their work. Gerontological content is woven throughout the training program, and the trainees are urged to access recommended online resources. A 6th workshop is dedicated to promoting culturally competent gerontological practice, again a subject woven through the training program. And lastly are 2 workshops relevant to the fast-growing demand for evidence-based practice, working with staff to measure the outcomes of practice and translating research evidence into gerontological social work practice. Next slide, please. The program's evaluation strategy is multifaceted. It includes plans for gathering extensive information about applicants and participants in the program and their training needs. It includes also pre- and post-training surveys of the participants' direct managers seeking their perspectives. Includes collecting feedback about each session and the overall program, and the critically important outcome evaluation, measuring changes in practice among the participating supervisors, measured before and 3 months and 1 year after the training. So to sum up, we believe that this program, through its training program and network building, targets the critical role of supervisors in the delivery of social services to older adults and their families. We see this as a vehicle for helping to build the number of professional social workers in the field of aging and enhancing the services provided to the growing population of older adults. And I would, of course, be glad if anyone wants to know more about the training program to be in touch with me. Thank you.
Thanks. Nora, are you going to take us through the next session?
Yes, thank you, John. So this is Nora O'Brien Zurich with the John A. Hartford Foundation, and I just want to explain why the John A. Hartford Foundation is funding this initiative. With our new strategic plan, which has a focus on helping practitioners that are providing today's care in receiving the information and the tools and knowledge that they need in order to deliver expert gerontological care to an aging population. We really see this as a great strategy to reach the social workers, the frontline workers, who are usually the first people to be introduced to working with older people out in the field. So this program is bringing an effective and proven training to practitioners. As was mentioned earlier, it was piloted in New York City for several years, funded by the Florence V. Burden Foundation, and had done an evaluation component as well. And we found it to be very effective in not only providing the supervisors with excellent supervisory training, which really does help to retain the frontline workers, but also to be able to provide an overview of providing expert gerontological clinical care to frontline workers who may not have had that type of training either in school or outside. We also see this as a commitment to breaking down the healthcare silos. one of the components in the training is interdisciplinary team care, and helping to train social workers in understanding their role and how they can also interact very effectively and efficiently with other members of the healthcare team, as well as to work with other professionals and non-professionals in the field, such as the direct care workforce, the home health aides, as well as working with the caregivers and family members themselves, which we know is very important in ensuring that older people are able to remain in their homes or their settings of choice in their later years. And the other issue that we feel very proud of is our partnership with the National Association of Social Work. This is a very strong national organization, as you heard from Joan, that spans 55 chapters across the country and has thousands of members. And we feel very strongly that having this ideal partnership with NASW will have the reach that we want in addressing the needs of social workers who may not have received the training that they need in working with an older workforce. As Joan mentioned in the survey that had been done by NASW several years ago, well, maybe 6 to 12% of social workers identify as being gerontologically trained. More than 75% of social workers are working with an older population and may not have received the adequate skills and training that they need in order to be competent and effective. And this training that is being provided by NASW is helping to train that workforce now on the ground where it's really needed. We invite other foundations to join us in this effort. As I mentioned, the Florence V. Burden Foundation was very instrumental in being able to pilot this project in New York City. And so that is one way that other foundations might be more locally based to identify other chapters or other community-based organizations that might want to implement this training and to help pilot it. But we're always looking for partners in funding for this, whether it be on a national level in helping to fund the brilliant and very effective team at NASW, or the National Coordinating Center, which is headed up by Barbara Silverstone and Dan Kaplan. But another way of being able to interact with this project is to help to fund the individual chapters of the National Association of Social Work, which you can find in any one of the 50 states, and then in D.C. and New York City as well. Part of this project has been mandated by the John A. Hartford Foundation is that a toolkit be developed for sustainability. So we see this as not something that will need continued commitment over the long term, but to really develop a way to bring in funding on a continuous basis. And this has actually been proven to be effective, as the 20 people who are starting in the New York City chapter already are actually paying their tuition for this. But these chapters do need startup funds. They do need help in reaching, in marketing, and in devising their programs for their own community. And this is really an area where other funders might be able to be very helpful in this. So the John A. Hartford Foundation feels really good about the partnership and the leaders. These are strong, nationally recognized leaders who have taken this on and are working very diligently to help improve care for older people by bringing an effective and proven training program to reach those practitioners out in the field. And certainly welcome any questions either now or in the future. Thank you for your time and attention.
Thanks so much, Nora, and to Joan and Barbara. I think we're moving on to the next slide. And at this point, I want to remind our audience that if you go to the GoToWebinar control panel, the blue panel you see on the right side of your screen, and go to the chat box, which is the last one, and open that, you will see a link that allows you to download the slides from today's presentation. We will also have the entire presentation available in about 2 weeks, and we'll send you information about that. At this point, we're going to turn to our questions. You can still go ahead and ask questions by typing them into the question box, which is in that same section. And I will start. We'll go back to Bronwyn and your colleagues at this point. A number of questions having to do with accessing this really interesting program that you've developed. and the question is it possible for individuals as well as senior center or senior center folks to be involved in the program at this point? And is there going to be a online version of the program available nationally at some point? And also, if you're one of the persons who's sent in a question asks, if they're interested as a senior center director, how do they contact you to find out more information?
Okay, great. Thank you for that question. So these courses are all available to anyone across the country right now. We provide training to individuals, to agencies, and groups across the country. We also provide CEUs. All of our courses are accredited by the Association for Social Work Boards. So if any sort of individual user is interested in taking these courses, they could do so right now at any time. If an organization is interested, they could also do that. In terms of this particular project on councils on aging, the program that we're funded for right now is in Massachusetts, and we're rolling out our second year of training, and we are actually, for folks that are on the phone in Massachusetts, we do have some spots available that would be at no cost to the individual because this is part of the grant that's been funded by the Department of Public Health. So we do have some open spots available in Massachusetts for folks that would be interested. But this training is available to a wide range of users, not just councils on aging staff, but people who work at area agencies on aging, you know, they have varied responsibilities and jobs. And I'm not sure if I know there are a couple layers of those questions, so I'm not sure if I got them all.
Well, thanks. That's very helpful. Kathy or Alan, anything to add to that?
One of the things that's sort of special about this program is it's what's called a blended model, and we have been able to have face-to-face as well as online courses. For those people across the country, they can just do the online courses, or we could work together in trying to replicate the whole blended program.
Yeah, just to add to that, we create guides for supervisors in training agencies so that if they want to do a blended program and may not have the luxury of Kathy, who happens to be our resident clinical training director here, they can take these guides that have been created by us and do their own in-person training, whether it be at an in-service or some sort of special meeting, but it really walks them through the way to bring this online training to life in a blended environment.
And the last thing I want to say is that, you know, we're very fortunate to have funding from the Department of Public Health, who recognizes the importance of this issue. That Alan's program does fund many more programs in aging and suicide than I've seen in many areas. The issue is that, well, I guess there's a couple things. One is we'd be very happy to work with any states or organizations that would like to approach their public health department to look at funding of this program, and also to speak to their counties and municipalities around the idea of funding behavioral health training for councils on aging.
Okay, great. Our next question, I'll turn to our other group, and Joan and Barbara and Nora, and that has to do with the interesting findings that you have in terms of the work with immigrants and refugees, where clearly most of the participants didn't feel that they had a strong background in that and learned a lot from the program. But you talk about cultural competence in all these programs. Could you say a little bit more about how that works and what kinds of things you're stressing and how you're reaching out in those issues? Joan, we can start with you. Yeah.
Good.
Go ahead, Joan. Or Barbara?
Well, I was going to ask Joan to, address the NASW standards in social work related to this issue. And I'm going to, are you there, Joan?
Yes.
Yeah.
So just as kind of an overview, the issue of cultural competence is one that has been important for the social work community for many, many years. And NASW for many years has not only had standards for cultural competence, which have just been updated, but we also have indicators that can be used by agencies to address their kind of status of cultural competence, and also recognizing a sense of the idea of cultural humility in the sense that we know that we can never know everything about another culture. And in aging services, as in other service delivery, we work with people according to the community who come from many different countries, many different places, speak many different languages, and however we provide services needs to be sensitive to that. We also have looked at that element of sort of the issues of institutional racism and racial equity, and how we as practitioners need to ensure that in how we're providing services, there is equity in terms of their availability in different communities and different neighborhoods, and access, so that we can be able to ensure that all older populations get the access to the services they need. And Barbara might want to talk a little more about the specifics.
Yeah, no, I think you've covered it well.
Okay.
Thanks.
This is Kathy. I just wanted to comment. One of the things that we had thought about when we were creating our online courses is that we knew that we had a lot of content in mental health and aging and suicide prevention among older adults, but we're very aware of the people at Councils on Aging and other aging organizations that they were really seeing quite diverse populations, including older immigrants and refugees, and very little content has been developed around that. So thanks to DPH's funding, we were able to create these two courses, Mental Wellness and Resilience Among Older Immigrants and Refugees, and Suicide Prevention Among Older Immigrants and Refugees. And some of the feedback we get is that there is so little content around this topic area that people have really appreciated a sense having it available. And we talk about age-friendly communities. This is, I think, part of an effort to address that.
Great. Nora, let's turn to you as the funder in the group. You talked a little bit about ways in which people at the local level could be involved in this, but could you expand that a little bit more? Obviously, the John A. Hartford Foundation funds more than just in social work, but in other professions as well. So do you have advice for funders who might be interested in expanding the gerontological workforce outside of the social work profession?
Yes, thank you, John. So the John A. Hartford Foundation does focus on physicians, nurses, and social workers historically. And originally, our strategic plan for 30 years was really in faculty development to build the geriatric academic capacity and to identify leaders in each of these fields who can do the research, do the teaching, be role models, and integrate the curriculum with gerontological knowledge-based information. We are now focusing on a downstream approach in reaching those practitioners, and working with social workers in this project is one way of doing that, but we have numerous other programs where we are looking for interprofessional team care. And in devising this program with the National Association of Social Work, although we are working with social workers primarily, but we did want to make sure that social workers could be trained in working with other professions as well. And if other funders are interested in looking at other professions, then likewise, working with nurses, nursing associations, physician groups, in order to learn how to do interprofessional team training. We do have a program that the Hartford Foundation funded many years ago, which may have been before its time, so we're actually revisiting this now, is our GIT program. Laughing there, the Gerontological Interdisciplinary Team Training. And this was focused on, educating a workforce and perhaps in the schools. And we're looking to really adapt this now in order to put it into the hands of practitioners to learn about each other's roles, learn how they can work together and communicate in a way that would be effective and more patient-centered, more patient-focused, as well as to give the patients and the caregivers a voice in the team care as well. We have many programs, John, and I could probably spend another hour talking about all of them, but I welcome any of the funders on this webinar to go to our website, to give me a call or any one of the program officers here. We'd be more than happy to talk to you about how we can partner together in working with other health professions. And we don't want to just include physicians, nurses, and social workers, perhaps just because of lack of funding and not surely because of lack of interest, but there are so many other professions such as pharmacists, physical therapists, occupational therapists, and direct care workers who really do need attention as well and funding in order to help them become more competent in working with older people and caregivers.
Thank you so much, Nora. Obviously, we've seen a lot of press recently about the shortage of physicians with geriatric training, but it's true, as you say, of all the professions that are and all the workforce that's working with older people these days. And of course, that the number of those people is going to double in the next 20 years, and yet we're not keeping up with that workforce need. At this point, I'm going to turn to our panelists one more time and ask them one by one to give their final words to our audience about what they think about this topic would be particularly relevant for our audience to take home with them. So, Bronwyn, let's start with you.
Great. Thank you so much, John. So I think, as you can see from this presentation, the competency-based training can lead to an earlier identification of mental health and substance use issues. And this really could means less cost to communities and less distress to older adults and families. And the training results that we presented here really speak to the need for this type of training and the role that social service practitioners, and in this case, councils on aging, can have in responding to the needs of an older adult population. And I thank you very much for this time and the opportunity to speak about this project.
Well, thank you so much, Bronwyn. Kathy?
I would talk about how important workforce training in mental health is. And because older adults are often, I think, shunted to the side, very stigmatized population around mental health and aging, that it's vital for funders to really try to consider ways to support this important training effort. Thank you.
Thanks, Kathy. Alan?
I have two messages, John. One is that depression is not an inevitable consequence of aging, and depression is an illness that is treatable, especially treatable. And the second is that I want to urge all of our listeners to offer some suicide prevention training to everyone in order to boost their confidence in their ability to speak with people who are suffering and who need the kind of professional help that social workers and other professions can provide. Thank you.
Thank you for that important word, Alan. Joan?
Thank you for this opportunity. I would like to reinforce the idea that for the many master's level social workers who are serving as supervisors in aging service settings, whether they're large ones or are maybe in small settings around the country and oftentimes maybe professionally isolated, a program like Supervisory Leaders in Aging that both provides more knowledge and skill development about both being a supervisor, as well as about aging and special issues related to aging populations, and also focuses on leadership development and the creation of a network among these social workers working in aging, really can have an impact on service delivery and really promoting stronger services and outcomes for older adults. It also reinforces, I think, the role of national organizations like the National Association of Social Workers and how we can have impact both nationally and at the local level by developing programs and reinforce some of what Nora was talking about, because we're regularly working with our colleagues in other disciplines to really promote the health and well-being of older adults.
Thank you, Joan. Barbara?
Yeah, thank you so much. I just want to stress the importance of the training of supervisors, of staff on the front lines of services to older adults and their families. I mean, over and over again, it's been shown that good supervision makes all the difference in the services that have been provided. And yet supervisors have been sort of a neglected component of the service, the whole service system. We found in New York in our past trainings that they were so glad to be part of a program where they were recognized and the importance of their work was recognized, and also their expressed need for advanced training. Just to remind everybody that not much is taught on the master's level in terms of supervision to social workers. So we find that is a very, very important thing to follow up in terms of continuing education. Thank you.
Thanks, Barbara. And Nora, the final word comes to you.
Thank you. I just would like to emphasize the need for this type of a training and reaching a workforce that is hungry for knowledge and how to be more competent in their jobs and working with older people and with their families. We're starting off this program in New York City, and there are 20 slots available, and they were oversubscribed by more than double the amount of people that we could accommodate in this pilot in the first course in New York City. And not only are the agencies paying the tuition, but they're also giving the supervisors the time off over an 8-week period in order to attend this training. This really speaks to the hunger and the need for a workforce that is looking for effective and appropriate and expert training. So I encourage everybody on this webinar to think about whether you're a funder, how you might be able to help the workforce through any one of these programs and fund them in the community, and any of the community-based organizations that might be on this call to think about how you might be able to implement such a program and support it in your own organizations. And certainly the John A. Hartford Foundation and anyone here in our office would be more than willing to help anybody figure out how you can develop a better and competent workforce to improve care for older people.
Well, thank you so much. I want to thank Bronwyn Keefe, the Associate Director at the Center for Aging and Disability Education and Research at the Boston University School of Social Work, and Kathy Kuhn, the Director of Workforce Development at the Center, Alan Holmland, the Director of Suicide Prevention Program at the Massachusetts Department of Public Health, Joan Zlotnick, the Principal Investigator of the Hartford NASW Supervisory Leaders in Aging Program, Barbara Silverstone, the Director and Co-Investigator of the Supervisory Leaders in Aging National Coordinating Center, and Nora OBrien Surik, the Senior Program Officer at the John A. Hartford Foundation, for their participation in today's program. We thank you all for everything you do to make life better for older adults. I also want to thank the John A. Hartford Foundation for their continuing support of this series and the American Society on Aging for their technical assistance. We will be making this presentation, both the audio and the slides, available to anyone who wishes to view them later free of charge. Just watch for the rebroadcast link at our website, giaging.org, giaging.org, or contact Grantmakers in Aging at info@giaging.org. I also want to remind those of you who are from the funding community to be sure to register for the GIA Annual Conference coming up in Washington, D.C. on October the 28th to the 30th. Much more information is at our website. And finally, I want to thank all of you for participating in today's webinar. Have a great day.